Gentlemen, picture this. In 10 years, your sex life could go one of two ways. On one path, you're confident, firm, and satisfied, enjoying intimacy without fear. On the other, you're battling weaker erections, infections, or even serious conditions like penile cancer, all because you ignored a few simple habits today. I'm Dr. Elizabeth Rains, urologist and men's health specialist. And in this video, I'll reveal 5 essential care steps every man must follow to protect his erections, his performance, and his long-term confidence, plus a bonus 6th tip at the end that almost no one talks about, but it could make all the difference for your future.
These aren't complicated routines or expensive treatments. They're straightforward, practical actions you can start right now, and they might just save you from years of frustration or regret. Quick question for you. How often do you honestly think about your penis health? Daily, rarely, or only when there's already a problem? Share your age and where you're watching from in the comments. I read everyone and try to respond personally.
Tip 1. Keep it active. One of the biggest mistakes men make as they age is neglecting their penis. Just like your brain, your heart, or your muscles, your penis needs regular activity to stay healthy. Think of it this way. If you don't use it, you risk losing it. When erections don't occur often enough, the tissues receive less oxygen and less blood flow. Over time, this lack of stimulation can weaken function and even contribute to long-term problems with performance. The good news? Staying active doesn't always mean frequent intercourse. Regular masturbation helps maintain blood flow and tissue health. And for men who aren't sexually active, there are other safe tools available, like vacuum pumps or pelvic physiotherapy exercises designed to encourage erections and circulation. The key point is this. Your penis needs regular oxygenation and stimulation to maintain its role as a healthy, functioning organ. Treat it with the same priority you give to exercise or keeping your mind sharp.
And here's something important. If you rely mostly on masturbation, I strongly recommend you also watch my separate video where I break down the pros and cons of daily self-stimulation. That way, you'll know exactly how to avoid common mistakes and adjust your habits if necessary. If you don't have regular partner contact, but masturbation is part of your routine, you can still confidently put a check mark next to this first point.
Tip 2. Prioritize hygiene. It may sound basic, but proper hygiene is absolutely essential for protecting your penis and overall sexual health. Neglecting this simple habit is one of the leading risk factors for serious problems, including penile cancer. In fact, in some countries, poor hygiene is directly linked to high cancer rates among men. Here's what to do. Wash the penis daily with mild neutral soap, like glycerin soap. Always dry thoroughly afterward to avoid buildup of moisture or secretions that can irritate the skin or foster infection. After sexual activity, wash again. Why? Because the vaginal pH differs from penile pH, and not cleaning afterward can disrupt the natural balance of bacteria and cause irritation or infection. Good hygiene isn't just about cleanliness. It's one of the most effective ways to prevent infections, inflammation, and long-term complications. Tip 3. Avoid intercourse with a partial erection. One of the most overlooked risks for men is engaging in sex when the penis is only partially hard. In this state, neither fully flaccid nor fully erect, the tissues are far more vulnerable to tiny, repeated injuries during penetration. These microtraumas may not be noticeable at first, but over time they can accumulate, forming small nodules under the skin. Those nodules can eventually lead to penile curvature, a condition known as Peyronie's disease. To protect yourself, always make sure you're fully erect before intercourse. If you notice difficulty achieving or maintaining firmness, see a urologist for evaluation. Addressing the problem early can prevent long-term damage and preserve both your function and confidence. Tip 4. Limit excessive pornography. While watching adult content occasionally isn't usually harmful, overexposure can quietly undermine your sexual health. When the brain becomes conditioned to constant, high-intensity visual stimulation, it adapts by needing stronger and stronger stimuli to feel aroused. This can lead to desensitization, where normal intimacy no longer provides the same level of excitement. Over time, some men find it difficult to perform with a real partner because their arousal is tied to artificial, screen-based triggers. To protect your natural responsiveness, set limits on how often you watch pornography. Focusing on real-life intimacy, emotional connection, and mindful arousal practices will help you stay sensitive, present, and confident during sex. Tip 5. Prioritize healthy lifestyle habits. Your sexual health is deeply tied to your overall lifestyle. The same choices that keep your heart, blood vessels, and hormones balanced also directly affect your erections, stamina, and confidence. Poor habits like smoking, heavy drinking, lack of exercise, and poor diet can slowly damage circulation and reduce testosterone levels. For example, smoking is one of the strongest risk factors for erectile dysfunction and Peyronie's disease because it weakens the blood vessels that supply your penis. On the other hand, consistent physical activity, balanced nutrition, proper hydration, and stress management naturally support your sexual function. A diet rich in fruits, vegetables, lean proteins, and healthy fats provides the building blocks your body needs for hormone production and vascular health. Think of lifestyle not just as background noise, but as the foundation of lasting sexual vitality. The better you care for your body, the better your body will perform when it matters most. Bonus tip: sleep without tight underwear. Here's one habit many men never consider, yet it can make a huge difference. Give your body freedom at night. Sleeping without underwear or choosing loose fitting underwear helps prevent unnecessary pressure on the penis during nocturnal erections, those natural nighttime and early morning erections that play a key role in oxygenating erectile tissue. When the penis is compressed by tight fabric, it can create micro trauma. Over time, these repeated minor injuries may lead to scar tissue formation, fibrosis, which in some men contributes to penile curvature and Peyronie's disease. By simply letting your body rest without restriction, you reduce this risk and allow your natural nighttime erections to do their job, keeping tissues healthy, flexible, and well supplied with blood. It's a small change, but one that supports long-term penile health and preserves firmness as you age. So there you have it, 5 simple, science-backed habits, plus a bonus tip that can make a huge difference in protecting your erections, preventing disease, and keeping your intimate health strong for years to come. Remember, your penis is like any other part of your body. It needs activity, hygiene, care, and healthy daily choices to function at its best. The earlier you start applying these habits, the better your results will be. If you found this video helpful, give it a thumbs up, share it with someone who could benefit, and don't forget to subscribe for more clear, practical advice on men's health. Leave your questions in the comments. I'll be checking them and may cover them in a future video. Take care of your body, because when you do, your confidence and performance naturally follow.